Hello, good evening. Welcome to the 20th episode of Talking Health with Dr. Laz, your favorite health program on television. I'm still Dr. Laz Eze. Yeah, it's a new year, and we are going to be focusing on certain agenda, for most of this month. We'll be asking people on the streets. As you can see, this episode is coming from you from the streets. We'll get questions from Nigerians, from policymakers, from civil society, organization representatives to know what they expect, from the health sector in 2021. 2020, you could describe it as the year of the pandemic. COVID-19 made significant impact and it's still here with us. I hope you're putting on your mask properly the way I'm putting it on. So COVID-19 is still here in addition to malaria, diabetes, typhoid fever, cancer, sickle cell anemia, and so many other health conditions. So we'll talk to everybody to know what to expect in 2021. So we are going to take a break, but just before you do that, ensure that you subscribe to our YouTube channel if you are yet to do so, Talk Health Niger TV, and also follow us on social media handles and keep on sending questions, posting your comments, and let's know what you think. We'll take a break, and when we return, the show continues. Please stay with us. Hello, welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, we're still on the streets of Abuja, and we are going to be moving around. Behind me is the Federal Ministry of Health headquarters at the Central Business District of Abuja. And from here, we are going to go into some other parts of Abuja. We are going to ask questions to Nigerians who are willing to speak to us. We will be asking them what they want to see in the health sector in 2021. Please watch, let's get some insight.
For me, I would say that what I want to see in the health sector coming this 2021 is that I would want the federal government to provide more incentive in the health sector so that people can have access to medications in different hospitals, both the federal and the private hospitals too. So the government should find a way to subsidize some healthcare expenses that people should, afford basic health.
I want to make the government they enter everywhere, like they check some things where they happen, because sometimes things they happen, government just they give people where they do work. The people, they come out, go check what they happen for outside. They go just the people who are complaining every day by day. And government not even know what they happen for Nigeria. It just send some people. So if the government do something of that, make them check people where it's supposed to enter everywhere sometimes. For a hospital, because now hospital be the main things where they give people work or where they help people. Now hospital be the main things. Or the person know where or person there where now hospital the carry person do work. So I made them put eyes for a hospital so that they go help them, give them better. Nobody say you go just carry money, they help another people who not supposed to do anything. So your hospital is very dry, and we don't see for last year, and we won't see better one where you don't pass the last year on. We know say you are continuing to try the work. So make the government put eyes for a hospital, help people. Some people, it's just there around, they don't get money sometimes to go help people do work or sometimes. So I want make government help now, make your hospital there away.
I think 2021, the first thing that the government should do is assess how successful they have been in 2020. Find out what the gaps are. And it cannot be done by the government alone. It can be done by NGOs, private sector, everybody critically analyzing what happened in 2020. It will guide you on what you're supposed to do in 2021. We will know as NGOs where we're supposed to come in really, where we're supposed to collaborate with the government. The government cannot do it alone, whether we like it or not. So with that information, 2021, we expect more collaboration with the government. We expect the government to take health as a priority. COVID-19 has not gone anywhere, it's still there. It's still there. So, and it's something that is real. So whatever decisions that they need to take has to be taken fast. And then after having that collaboration, developing a plan. The private sector and the NGOs should know where they're coming. The government should know where they're coming, so that we don't keep repeating the same thing. One of the communities that I'm talking about, Damangaza, we did, in 2020, the palliatives that we shared. Some other people share palliatives. Meanwhile, there are some other communities that palliatives did not get to. So it's time for us to be more strategic in our planning. The state government have to come in. When I say government, I mean federal and state. The state, in fact, is in their hands. The state is like the president of the states. So the state, they give the state money. The state have budgets. So they should stop pretending as if the federal government has to give them everything. The state, everything is in their hands because some states are doing better than others. So every state must come up with a good plan. And then the basic healthcare provision fund is still there. No matter how small the money is, they're still giving them money. And they want to know what they're using the money for. This is the time for you to plan how much you are going to do as a state for the health sector. And then we as NGOs want to know so that we can know how to come in. And we believe that every NGO, you don't have to spread yourself thin by going to too many states. Take one state, please, because there's confusion right now. Take one state, take 1 or 2 or 3 communities and focus. Don't put your hand like, that's what we do in the health sector as NGOs. We'll be in this state, we'll be in that state. At the end of the day, you spread yourself thin. You cannot really have the impact that you're expecting. I believe personally that NGOs should take one state. Then in that state, take one LGA. In that LGA, take one community or one ward, whichever one works, and then work with the government on this. And then the state government must come out and say, health is a priority. Nothing else is good enough. The National Health Act is a fantastic document and a fantastic plan for the health sector. Unfortunately, it has not been implemented as it should. The Patient's Bill of Rights, is that patients have rights. And those rights should be adhered to when you access healthcare, when you go to the health center or health facility. Till today, as I'm talking to you, I don't even think both the health workers and the people who need health know what the Patient's Bill of Rights is all about. And that's just the truth. What we should do in regard to that is already a law, is a right. The government should make sure that people are aware by communicating the information as to the rights of people. NGOs also have to come together with the government to tell people in communities. Then everybody should know, the health workers should be taught properly that when a patient comes in, you should be able to explain those rights to a potential patient. That patient is like a customer. It's business. The person comes in, if the person has insurance, which is what we are praying for, like now, I hope that insurance will start working properly because as far as I'm concerned, that one is even dead. That one is even dead as far as I'm concerned. But if somebody comes in and the person is ill, the nurse or the health worker should see that person as a customer, and that person should be treated properly. That's in the area of, and they will tell you what the law says. You have a right to ask questions. Why are you giving me this drug? And then you treat the person. But in Nigerian hospitals, first, sorry, Dr. Laz, but doctors feel like they're gods. You people feel that you are gods. So when somebody comes to the hospital, you treat the person as if you're doing the person a favor. And you don't understand that the job of a doctor is a philanthropic work. If you cannot do it, leave that business. Go and sell clothes in the market. That's how I feel about doctors. And because of that, people are afraid of you. And because people are afraid of you people cannot ask questions. And because people cannot ask questions, people are never satisfied with the work that you do.
Is it just doctors or healthcare?
The whole healthcare workers, but doctors are at the top of the ladder. I particularly mention doctors because they're the ones you don't see. You hardly see them. And the way you see them, they behave like gods. And because of that, people are afraid. So because of that, a lot of things go wrong that shouldn't have. That's the truth. I'm talking also from personal experience. So the basic healthcare provision is a beautiful document. If it's implemented properly, in fact, Nigerians will smile. At least if it is merged together with the normal health budget. It's not as if it's basic healthcare provision fund from the National Health Act. It is not the health budget. It's an addition to support that budget. If the health budget is working and the basic healthcare provision, the money for the National Health Act, which is working, and you merge all of them together, we won't get to where we're going, but we'll be moving. Right now, some states are doing better than others, like I said. Like in the FCT, I see some improvements. At least they are moving, even if they have not reached where they are going to. You go to some health centers and they have almost everything that we expect them to have. In FCT, we have 62 health centers in the whole of the FCT, the 6 area councils, 12 for AMAC, and then all the other ones 10. So if you go to those particular facilities, you get better treatment. But people need to know that before you can get that treatment, you have to register. I can't just walk into any of those hospitals and say, okay, all of those primary healthcare centers, I say, treat me. I'm on. No, there's a registration process, which people don't know. I don't even know how people get registered because I have not heard anything in the news.
For treatment or for health insurance? For
health insurance, the whole package. Okay. You're supposed to have like a card. And it's that card that allows you to be able to access health. So now, if you don't have that card, you can't access. You can't just go there and access health like that. You have to be registered. It goes through a registration process. But people should know this. And even now, they say they've already registered over how many 100,000. Okay, how did you do it? That's the question I'm asking, because even in the communities where I'm asking them, are you aware? They're not aware. There are gaps everywhere.
So welcome back to the program. Yes, you've listened to a couple of persons who talked to us around Area 2, Gariki area of Abuja. And you also listened to Mrs. Chika Offor, a civil society person. So we'll take another break. And when we return, I'll take you to the office of the Director of Family Health at the Federal Ministry of Health, and we also get what the Federal Ministry has for Nigerians in 2021. COVID-19 is still here, the pandemic is still there. Make sure that you wear your mask properly, covering your nose just as I'm putting it on now. Don't wear for the jaw or hang it up somewhere, and keep protecting ourselves.
I think 2020, it's a unique year. As you said, it's a very interesting year. It has been a year that has been quite challenging, but at the same time, we've learned a lot of lessons. We've learned that we can do things differently. The first thing that happened to us, we realized, was disruption of services, essential services, especially for us delivering essential services around maternal, newborn, and child health. We could not even deliver family planning commodities. So we have to now come up with immediate innovations of how do we sustain services. So we've learned so much. We've learned that we have to do things differently, not the ways that we have been doing. And one key areas also we've learned is to work virtually. So it has been a very, very tasking year, and I can say very, very busy, because we also achieved quite a lot, despite the fact that it has reduced our interactions physically. But we achieved so much working virtually. So the great lessons we have learned is that irrespective of public health emergencies, like what COVID has taught us to do differently, we have been having emergencies in these countries, whether as a result of man-made disasters or public health emergencies due to diseases. But we've not seen the magnitude of disruption up to this level, but it does happen at those levels. So what we did immediately was to revisit some of our policies. There's no doubt we've learned lessons in 2020 due to the COVID-19 pandemic. It has taught us how to work better. It has taught us how to be more innovative, because one, the impact we felt on essential services disruption, including family planning and sexual and reproductive health services. So going forward in 2021, we have learned to do things differently. We are looking at our policies to see that it captures how do we deliver essential services and sustain services despite public health emergencies, similar to what we have experienced as a result of the COVID pandemic. So some of it, we have revisited some of our public policies to capture how to deliver within public health emergencies. And then apart from policies also, we've also learned to work more effectively, not only physical, because we've saved a lot of cost, when you have physical interactive meetings. So we've learned that we can do quite a lot virtually, not only at the national levels. We've had several coordination meetings with the state and also even up to the local government level. So these are lessons that we've learned in 2020, and we are taking them to 2021. So, but most importantly, due to the economic situation, and then looking at the magnitude, the burden of the problems of reproductive, maternal, newborn, and child health in Nigeria, our story is not yet a success to celebrate. We are still making some modest progress, but we still have a lot to do. And then unfortunately, the COVID-19 has impacted negatively. So what we need to do in 2021, we don't have much time, if I can say, is to quickly traject our success. We have to move very fast to see how we can improve survival of women, survival of children, including the elderly people, and also improve nutritional status of Nigeria. And that has to happen within a short time based on all the lessons that we have learned. So part of what we try to do, because we don't have adequate resources, and then of course everywhere is affected globally, including our development partners, we are now trying to see how do we maximize the effect of resources in the country. And this is where we will focus in 2021.
So what we say, you're looking at effective or efficient utilization of resources.
Exactly.
Getting maximum value for
minimal resources and getting maximum outcome. Outcome in terms of better outcomes in delivery of maternal, newborn, and child health. So fortunately, the Honorable Minister of Health, Dr. Emmanuel Ihanire, launched what we call the RAMCA, Multi-Stakeholder Coordination Platform. And this is going to be operationalized in 2021. We've already developed the operational plan, which he is going to disseminate beginning of the year, and that will roll out implementation. So the purpose of that is to see how we harness all available resources to make maximum impact.
The RAMCA idea looks good. It looks like a multi-stakeholder coordination platform.
Yes.
Because there's been a lot of criticism from a lot of stakeholders about verticalization of interventions, support, a lot of disorganization that leads to resources, duplication of efforts, and waste. So,
and this is exactly what the RAMCA is supposed to address. Duplication, scattered, uncoordinated, unsystematic activities and programs happening in the country. So it does not give us maximum outcome of the efforts.
So still talking about RAMCA, but let me try to explain it for those who are watching. It simply means reproductive, maternal, newborn, child, adolescent, elderly health, plus nutrition.
Yes.
Okay. So is a complex abbreviation, but that's essentially what it means. And the Department of Family Health, like the director just told us, is seeing how they can get more with minimal investment, harnessing all the resources, including the donor support.
Yes, everybody is part of RAMCA. Not only government, even in government, not only Ministry of Health and its agencies, but key line ministries have a role to play in the health of the family. The Ministry of Finance, Budget and Planning, the Ministry of Women Affairs. In fact, the Honorable Minister of Women Affairs is a co-chair to the Honorable Minister of Health, who chairs the RAMCA. The Ministry of Water Resources, when we talk about waterborne diseases, the need for water in health facilities at primary health care level, Ministry of Water Resources play a key role. Ministry, even electricity, power and supply. The Ministry of Agriculture, we talk about nutrition, it's a key to the nutritional status, especially children under 5 years. Ministry of Information. And then we look also, Ministry of Education is a key partner, and Ministry of Environment. So you can see all these are line ministries that one way or the other, they have a very significant role to play in the health of the family. Then if you look outside, and several other agencies of government, then outside government, all our development partners still remains critical partners in it. Apart from our development partners, civil society organizations, they have a very important role to play, especially at the delivery, at the service delivery level, at the grassroots level. And also as advocates, we need the voice of the civil society to achieve a lot in Nigeria, especially towards achieving the health of women. And then we also have professional organizations, associations. The Nigerian Medical Associations are key partners. And remember, Nigerian Medical Association has all the disciplines under its umbrella. The SOGON, the Pediatric Association, even the Neonatology Association of Nigeria are key members of it. So all this, they play a very critical role. The private sectors are not left out. We want to tap the potentials in private sectors and work more closely with them in the delivery of reproductive, maternal, newborn, and child health, including care of the elderly in Nigeria. They have a critical role to play also in a provision of family planning services in Nigeria. So all philanthropists, individuals that want to be part of it are all. So the whole idea is to bring talent, is to bring the knowledge, expertise, and also available resources within the country and even outside the country so that we can tap and move the agenda of the health of women, children, and adolescents in Nigeria forward, including the elderly people. They are not left out.
Yes, leaving no one behind.
Leaving no one behind, exactly.
That sounds really good. So I could say that everyone is under one roof.
Thank you.
And as it has to do with,
the health of women, children, and adolescents, and elderly
people, and indeed all Nigerians.
All Nigerians.
And thank you so much for tuning in and listening. Please feel free to send questions, post your comments on our social media platforms displayed on the screen, and we'll always make sure that we provide feedback. And anyone we don't have answers for, we are sure that we'll get the answers and get back to you. So 2021, so much for the health sector. Please play your part. Let's all play our parts. My name is still Dr. Laz Eze. Thanks for watching. See you same station, same time next week. Bye for now.